Hello, welcome to the webinar, The Value of Vital Signs, ECG, and Spirometry Testing in Primary Care. Throughout this presentation, experts with Midmark Corporation will be sharing how digital diagnostic devices can help improve clinical workflows and make detection at the primary care level simple and effective, creating a better healthcare experience. A couple housekeeping notes before we get started. We want this webinar to be an interactive experience for our audience. You are encouraged to ask questions using the questions pane in your GoToWebinar attendee panel. We have saved some time near the end of the webinar to answer your questions. Should you need any assistance during the webinar, please don't hesitate to contact us via the questions pane in your attendee panel. We'd also like to thank our sponsor, Midmark. Midmark is the only clinical environmental design company that enables a better care experience at the point of care in medical, dental, and animal health. Their unique approach to designing their products and solutions revolves around a single idea: harmonizing space, technology, and workflows to enhance interactions between patients and caregivers. It's my pleasure to introduce our two presenters today, Kylie Gilbert, Medical Marketing Manager at Midmark Corporation, and Dustin Chidone, Clinical Education Manager at Midmark Corporation. Kylie, Dustin, please take it away.
Thanks so much, Maria. Dustin and I are excited to have the opportunity to speak to you all today. As the digitalization at the point of care continues, there's an increasing number of connected diagnostic devices that can be used in the primary care environment to help increase efficiency, reduce errors, and improve patient care for one facility or across a network of care sites. We're going to discuss today how digital diagnostic devices such as vital signs, ECG, and spirometers can help improve clinical workflow and make detection at the primary care level simple and effective, creating a better healthcare experience. After today's conversation, we hope you walk away with the following takeaways: realizing how diagnostic testing in primary care can positively impact clinical outcomes for some critical disease states. We also hope you learn how diagnostic testing can help minimize the financial burdens on healthcare systems, and understanding how to overcome some of the challenges we know exist in regards to ECG, spirometry, and vital signs acquisition in the primary care setting. We're going to kick off today's conversation with a poll question.
Thank you, Kylie. So audience, please participate in this poll. The question is, what % of office-based care visits are made to the primary care physician? So what do you think the answer is? The selections are 35%, 80%, 47%, or 51%. We'll give you a little bit to answer this. Okay, most of the audience has answered, so I'm going to close the poll. All right, here are the results. Kylie, Dustin, thoughts?
All right, it looks like the majority of the group chose 80% here. Actually, when analyzing all patient visits across the continuum of care, patients are visiting the primary care clinic and office space 60% of the time compared to all other sites of care, with the majority of office-based visits being made to the primary care physician. This is likely the healthcare provider patients are seeing the most frequently. So you may ask yourself, why are we so focused on the intervention at the primary care level during the conversation today? And the reason behind that is it's estimated that by 2029, outpatient visits nationally will total 2.7 billion visits, which is more than double all visits in the rest of the healthcare continuum combined. So not only are we likely seeing the primary care physician the most frequently, but these care providers are in an ideal position to provide patients with a whole health approach. They can look at all aspects of a patient's overall health and not focus on just one specific area. 90% of the U.S. $3.8 trillion in annual healthcare expenditures are from chronic diseases. over 20 million of newly insured Americans, 47 million baby boomers reaching age 65 over the next decade, and a dramatic rise in obesity are creating a huge demand for healthcare. These are key drivers as to why we are seeing a tremendous shift and investment into the non-acute space.
To support the statistic Kylie shared with us, when evaluating the benefits of the primary care setting, there are two key areas of focus that relate to our conversation today. The increased focus on expanding preventative treatments and managing health problems before they are serious enough to require hospitalization or emergency services. Studies have shown lower rates of hospitalization for ambulatory care sensitive conditions are strongly associated with receiving primary care, and primary care physicians are in the ideal position to provide their patients with an even broader whole health approach to patient care. As the patient demographic continues to grow and become increasingly more complex, efficient and effective diagnosis and treatment at the primary care level becomes increasingly more important. Let's start by looking at vital signs acquisition in the primary care setting.
Vital signs are taken at nearly every single patient encounter. Vital signs including respiratory rate, oxygen saturation, pulse, blood pressure, and temperature are regarded as an essential part of monitoring patients' health conditions. Studies show that changes in vital signs prior can be a leading indicator to clinical deterioration. Early detection is key to a timely intervention. The importance doesn't just lie with ensuring we're collecting vital signs at every patient visit, but it's ensuring we're capturing those vital signs accurately for a clear picture of that patient's health condition. Dustin's going to elaborate a little bit more on this.
Yeah, thanks, Kylie. So vital signs are useful for both that immediate and future care. At any given medical appointment, taking vital signs is one way practitioners can identify an acute medical problem. Measuring vital signs can quickly quantify the magnitude of an illness and how well the body is coping with the resulting physiological stress. Vital signs are also valuable as long-term health indicators for larger areas of concern. For example, let's take a look at hypertension. Regularly checking blood pressure and tracking it appropriately is essential to proper hypertension management. In many cases, it is by these documented regular checks that the original diagnosis was made, since the vast majority of our sufferers have no symptoms whatsoever. But without regularly checking blood pressure and tracking the results, it would be difficult to confirm this diagnosis. Blood pressure is very costly, as Kylie will share.
So while we know all vital signs are important, the vital sign with the biggest impact on healthcare expenses is blood pressure measurement. $46 billion is the annual cost of treating high blood pressure in the United States. And it's unfortunate that 1 out of every 2 U.S. adults have high blood pressure. But what is becoming more clear is the number of Americans whose blood pressure may be measured inaccurately. Incorrect measurements of blood pressure from improper technique by as little as 5 millimeters of mercury can lead to inappropriate treatment and unnecessary costs, and it affects as many as 30 million Americans. Incorrect measurement of a true blood pressure doesn't just increase costs for the patient, but it's increasing the cost for the healthcare system as well. The cost of incorrectly capturing the patient's blood pressure can add up very quickly. One physician typically has about 1,900 patients, and of those patients, 9.8% are affected by the overestimation of high blood pressure errors. The cost for overtreatment of hypertension per patient is $733. So if you multiply these values, the average cost per practicing physician is $135,000 annually. Now think about how many physicians you have practicing within your healthcare system. This is a large, unnecessary expense many healthcare systems may not even realize they're experiencing. Dustin is going to share with you some areas of opportunity to overcome the challenges that we often hear associated with the vital signs acquisition process.
Those of us on this call today know that vital sign acquisition is something completed on every patient during every visit. But how can we improve on that vital sign acquisition? In my role as a clinical educator, I visit multiple primary care offices a month. I have seen workflows for vital sign acquisition vary from vital signs in the hall, blood pressure only captured in the hall with SpO2 and temperature in the room, vital signs in a triage room, then the patient moved to the exam room. Wait in a hallway with a manual blood pressure in the room, followed by SpO2 and temperature, and that's just to name a few. I am sure as I'm speaking to these, some of you are thinking about your practice workflow. The use of an all-in-one vital signs device with improved integrated workflow at the point of care and standardization of vital sign intake throughout the primary care setting, facilities can save time, money, and improve patient outcomes. Let's take a look at some of the statistics on traditional non-integrated workflow. It requires 160% more time to gather vital signs in a traditional workflow than in one that integrates vital signs at the point of care. This leads to 5% time wasted by each medical assessment. That wasted time equates to about $1,440 per medical assessment. By bringing all vital signs acquisition, including that wait, to the point of care, you can save approximately 69 seconds per patient visit. Are there conversations around transcription errors in your office? In a recent conversation during one of my on-site visits with a physician and a nurse, I asked how often they see vital signs incorrectly transcribed. The nurse felt it was about 5% of the time, while the physician shared he thought it was more like 30% of the time. We often hear similar responses, calling attention to the errors facilities experience day in and day out, possibly without even realizing the true impact such errors are having on their patient care. In a manual documentation process, studies have shown that manual transcription of vital signs data can produce a 17% rate of error. For example, an error in blood pressure measurement, whether a transcription error or a measurement error, can significantly impact diagnosis and care for a patient. An accurate blood pressure reading will help with understanding a patient's overall clinical picture. Physicians rely on blood pressure readings to make clinical decisions for their patients. So blood pressure measurement needs to be accurate, precise, and repeatable. With an automated device, you can help ensure that each patient who walks into your primary care office is having their blood pressure taken the exact same way every time. We're all human. We hear, see, and think differently. Use of an automated device can help overcome those differences. Many influential standard-setting bodies, such as the American Heart Association, the American College of Cardiology, and the American Medical Association, suggest that automated systems in clinical settings are associated with more effective blood pressure management protocols at the point of care. When you combine improved integrated workflow at the point of care and standardization of vital sign intake with automated EMR connectivity to help reduce transcription errors, physicians can feel more confident they are getting the most accurate data possible. So, how do we ensure these new technologies and point of care workflow are being used appropriately? Staff training. Equipment providers often have training solutions for staff, whether it's on-site training, virtual training, or e-learning modules to help familiarize staff with the equipment. They also often provide education on current best practice for vital sign acquisition and educate to the latest American Medical Association or American Heart Association's guidance on tips for obtaining accurate blood pressure measurements. Now that we've discussed the importance of vital sign acquisition in the primary care setting, Kylie's going to talk about the importance of the ECG testing.
At the primary care level, An ECG is the gold standard in identifying and assessing treatment of heart disease and related conditions. Research demonstrates that ECG abnormalities are independently associated with future cardiovascular events and death. ECG screening, therefore, can be an effective measurement of potential upcoming cardiovascular events. Unfortunately, heart disease is the #1 leading cause of death in the U.S. Someone suffers a heart attack every 40 seconds in America. That means during the time we're on this webinar, 90 Americans will experience a heart attack. That is why it is so critical to bring ECG testing to the front lines of care, primary care. We want to help clinicians identify arterial fibrillation and other ECG abnormalities that are associated with cardiovascular events early, not only to positively impact the patient's life, but to avoid costly procedures for the patient and the care facility. Dustin, from your perspective, will you share why ECG testing is so important?
Yes. The goal of providing diagnostic testing in a primary care setting is to equip primary care providers to be the tip of the spear when it comes to their patients' overall health by providing proactive care, not just reactive care. Being able to complete a yearly diagnostic ECG right within the primary care setting could save someone's life. When there is a person suffering a heart attack every 40 seconds, again, like Kylie said, every 40 seconds in America, we need to ensure we are doing all we can to reduce the incidence of debilitating heart conditions. A resting ECG is an essential tool that gives providers the data they need to make an early and accurate diagnosis at the point of care. Kylie's going to touch on what these debilitating heart conditions are costing healthcare systems.
Thanks, Dustin. So for the costs associated with heart disease and ECG in the healthcare system, annually about 1 in every 6 U.S. healthcare dollars are spent on diagnosing and treating cardiovascular disease. Heart disease costs the United States about $219 billion each year. This total includes the cost of healthcare services, medications, and premature death. But by 2030, annual direct medical costs associated with cardiovascular disease are projected to rise to more than $818 billion, while lost productivity costs could exceed $275 billion. These costs continue to grow at a rapidly increasing pace. In order to keep the costs down of hospitalizations and premature death, screening for these conditions and providing preventative care earlier is needed. Now, Dustin's going to touch on how to overcome some of the challenges that he has experienced within the ECG acquisition process.
So, primary care providers are in that ideal position to diagnose heart disease early to help drive down some of those costs Kylie just spoke about. We know in the primary care setting, there are challenges with any deviation to that patient visit workflow. But we want to tell you a little bit more about some of the solutions that exist to overcome those in-office diagnostic ECG challenges. In today's market, a PC-based ECG can provide the user with a number of workflow and data efficiencies. A PC-based ECG enables staff to capture, review, and edit test results all on one computer screen. A digital workflow also enables data to automatically import into the patient's EMR chart. With each ECG, the software within the EMR will allow providers to easily compare ECGs over time. As with any chronic diseases like heart disease, it is essential to continue that monitoring over time and adjust care protocols based on those results. A digital workflow makes this comparison more seamless. Interpreting an ECG with a digital device is more efficient with built-in software tools like calipers, auto-interpretation, the data matrix, and that ability to compare ECGs from one screen. A PC-based ECG can be connected to the EMR, not only helping streamline the flow of data, but also reducing the number of steps it takes to capture, review, and save a patient's test. A traditional box ECG with an EMR workflow requires approximately 11 steps, while an integrated PC-based ECG only has 6. PC-based ECGs with EMR integration not only save time for the technician, it saves time for the providers. They no longer have to wait on a paper printout. They can review the ECG and the patient's EMR right from their desk. During one of my on-site visits, a clinician had told me over and over what a time saver that this workflow has provided for him. He no longer has to hunt down paper tracings that may have been misplaced or scanned into the wrong chart. By utilizing a digital ECG device while making slight deviations to the office workflow, efficiencies can be improved, time can be saved for the provider and staff, and ultimately, patient outcomes can be improved.
So for our next segment here, we're going to ask another poll question to kick us off.
Thanks, Kylie. So the next poll question is, have you done a spirometry test at your primary care office? So we'd just like to hear from you if you guys have done this before. So please fill in the question, and we'll give you some time to answer it. Okay, close the poll, share the results. So most have not. Kylie, Dustin, do you have thoughts on that?
Yeah, so we're actually going to ask you to keep the results you're seeing here on screen. So it looks like, I mean, I'm not a mental math wizard here, but it looks like probably 2/3 of the group have never done a spirometry test. So keep that in mind as we continue into this next segment about spirometry. So 47% of primary care physicians report not even having a spirometry device. And 30% of patients ever receive spirometry testing. So again, kind of looking at just the population that is on this webinar today, you could see that 2/3 have not done it. So that statistic kind of backs up the statistic we're seeing here, where 30% of patients never receive a spirometry test ever. Yet COPD is the 3rd leading cause of death by disease in the U.S., and spirometry remains the most effective method for staging and assessing patients with COPD. Most experts consider spirometry essential for effective disease management. There are many other medical conditions that we know spirometry can help diagnose and treat, but COPD is a disease state that is continuing to get growing attention. 24 million Americans are estimated to have COPD, yet half of those are believed to be undiagnosed. So for every 20 patients that walk into a primary care facility, which is about the number of patients a primary care physician may see in a day, 2 of those 20 patients are going to leave with undiagnosed COPD. Unfortunately, there's no cure for COPD. But the good news is, if we identify COPD early, there are many effective therapeutic options that reduce the burden of the disease for the patient. Spirometry at the primary care level can help detect cases at an early stage when intervention may prevent future progression of the disease and positively impact the patient's quality of life. In an analysis of impact of spirometry testing, there were 235 subjects, and after performing spirometry, 130 of those subjects received a new diagnosis, most commonly COPD. the patients with COPD were significantly undertreated before performing a spirometry test. So by performing spirometry in the primary care setting, clinicians can be proactive in diagnosing patients and ensuring their COPD diagnosis is accurate. So I'm going to touch a little bit on the costs related to COPD. So we know spirometry can help address costs associated with all respiratory diseases, but for the topic today, we're just going to focus on the cost of COPD. The total estimated cost of COPD in 2020 was $49 billion, and 75% of all direct COPD disease costs are oftentimes from preventable exacerbations. So by utilizing spirometry in the primary care setting and providing care to patients sooner, some preventable exacerbations can be eliminated. Therefore, we're reducing the costs for the health system.
And not only can we cut costs, Kylie, but by performing spirometry at the primary care setting, we ensure the primary care providers have an accurate clinical understanding of their patient's lung function. Spirometry is an essential tool in properly staging COPD, a step that is critical in determining the best therapeutic option. With the added benefits of eliminating additional wait time to see a specialist when the patient is referred out instead of doing spirometry at the primary care setting, which can cause a delay in that patient's care. Increased convenience for the patient, leading to higher patient satisfaction scores. They are able to receive all the care they need in that one visit. Physicians are getting timely results, enabling them to provide recommended treatments during the same visit. And with 75% of COPD-related expenses due to preventable exacerbations, by performing spirometry in primary care to help prevent exacerbations, expenses for both hospital systems and patients can be reduced. Now that we understand the benefits of spirometry, how do we overcome those testing challenges? So 36% of primary care physicians report inability to incorporate spirometry into their patient workflow. But spirometry can be a viable option for primary care physicians when proper equipment is used, staff are trained, and expectations are properly set for the patient. Today, digital spirometers are affordable for primary care practices, and tests are reimbursable when coded appropriately. Equipment today has also become more advanced to aid in the diagnosis of respiratory conditions. Some features include reports showing basic lung capacity measures to enable a probable diagnosis, a flow loop pattern, and on-screen alerts that will show how a test might be suboptimal, as well as effort grading, along with the development of lower limit of normal, or LLN. The software can aid in primary care physicians' interpretation of the data. In-office spirometry does not require a physician or a respiratory therapist. Some equipment manufacturers offer in-person training for staff on using their specific equipment to overcome any learning curves. There are also embedded training videos within the software, available for staff leverage to refresh their memory on how to conduct the test. Patient effort is critical to receive accurate test results. Just like the embedded training videos for the staff, there are embedded training videos that can be assessed in the testing process to properly set expectations for the patient. This will assist in getting the optimal effort from the patient right away. Throughout conducting research on this topic, we found a powerful quote by Dr. Barbara P. Young, MD, Master of Science, Fellow of the American Academy of Family Physicians. She was a member of the expert review panel that developed the current asthma care guidelines and on the World Health Organization, or WHO, panel that developed the International Primary Care Respiratory Guidelines for Obstructive Lung Disease. In that research, she stated, spirometry is important and very doable in practice. And she agreed, it is disruptive to patient flow in a busy office. But even though an ECG is disruptive, no one hesitates to order it. She shared that she does not know a primary care practice that is not going to perform or does not know how to perform EKGs. Everybody knows how to do them and understands how to fit them into their practice workflow. Doing spirometry for shortness of breath should be exactly the same. Once you recognize the value of the test, you're going to figure out how to work it into your practice. Just as Dr. Yan alluded to, spirometry is very important diagnostic test that can be easily adopted with the right tools and right training. Staff training, as you can see, is a common theme to overcoming challenges of diagnostic device use in the primary care setting. As a recommendation, when looking to purchase diagnostic devices for your primary care office, one question I would make sure I ask is what type of staff training and support does that manufacturer provide? Offices can have the best equipment available, but if staff do not understand how to use the device properly, they will not be taking full advantage of the data the device can provide for helping to improve the patient's overall health, which ties right into the quadruple aim Kylie is going to speak about.
So as healthcare continues to move away from a fee-for-service approach and further adopt the MIPS incentive-based approach, partners and suppliers need to be invested in helping health systems in the pursuit of the quadruple aim framework. I'm sure many of you are familiar with quadruple aim. It describes an approach to optimizing health system performance and is based on the Toyota triangle of cost, quality, and lead time. You can't focus on one area at the sacrifice of one of the others. The quadruple aim is the development on the original triple aim framework, which focused on patient outcome, patient satisfaction, and reducing costs. With the quadruple aim, the importance of the care team well-being is added. Healthy, happy, and engaged employees perform better. And with today's labor shortages in the healthcare environment, it is more important now than ever. Throughout our discussion today, I hope you have heard how diagnostic testing at the primary care level could positively impact patient outcomes and patient experience, improve the care team well-being, and reduce costs. The components of the quadruple aim. For each one of these areas of focus, the earlier intervention can occur. It enables the care providers to not only improve their patients' quality of life, but cut back on unnecessary expenses they may experience tied to chronic disease conditions. Dustin also spoke to solutions to help overcome some of the challenges care providers are experiencing to improve their overall well-being. At Midmark, we can help with how to design better care by taking into consideration the quadruple aim. Including diagnostic testing at the primary care level can enable primary care physicians to positively impact their clinical outcomes for their patient population by offering that whole health approach we spoke to earlier. They can create a more favorable experience for their patients, and they can reduce the financial impact on their organization and their patients. And they can allow for increase in staff productivity and satisfaction by standardizing and improving their workflows. So at this time now, I think we'll go ahead and open it up for any questions you may have for Dustin or myself.
Thank you, Kylie and Dustin. So for the first question, the question is, how do I encourage my staff to adopt a PC-based ECG workflow versus a box ECG?
Yeah, I can take that question. The PC-based ECG brings many of those testing workflow benefits that we spoke to. But not only that, if you were to ask your staff, how often are they running into maintenance issues with that box, that traditional box device? Are they running out of paper? Are they running out of ink? Are they getting tired of scanning printouts into the EMR? And how many times have they scanned the printout into the wrong EMR? So those are some of the big hitters that I would speak with your staff about, and then also explain the benefits of that on-screen editing feature that the providers can do right there from their desk on one screen.
Okay, great. Next question is, we have a SpO2 sensor, thermometer, and BP device in each room. How does combining these into one device benefit our workflow?
Yeah, I'll go ahead and take that one. I think the scenario you described there is kind of that traditional setup that a lot of us are used to seeing. But as technology continues to advance, we have a better understanding of how all vital signs being combined in one device, you're then enabled to populate the data in one location. So then when you add that additional feature of the EMR connectivity, you're enabling all vital signs data to flow not only from the capture into the device, but then the device into that patient's chart seamlessly, eliminating the potential for those manual transcription errors. So you're not only, every time you add an individual vital signs, you have that opportunity for transcription error each and every time. So you can reduce that and also just overall improve that workflow for your staff.
Got it. Okay, next question. Is automated BP capture preferred over manual?
Yeah, I can go ahead and answer that. So while, manual BP is still considered that gold standard if done properly, as we kind of alluded to before, we know staff members, they're busy, right? They're running around doing multiple tasks. And each one may capture blood pressure a little bit differently. As I spoke to before, we hear, see, think a little bit differently. So when you bring an automated blood pressure device into your organization, you can assure acquisition is being captured consistently every time. The American Heart Association, the American College of Cardiology, and also the American Medical Association have all determined that automated blood pressure is the most effective means to effectively manage that blood pressure in those busy practice settings.
Okay, thank you, Dustin. So next question, how does performing spirometry satisfy the quadruple aim?
Yeah, I can take this. It's a great question, and I think, as health systems are starting to adopt the quadruple aim a little bit more, this is kind of a common theme we're seeing and wanting to better understand how each of these products satisfies that need. So like I spoke about with the quadruple aim, there's really 4 areas of focus. That's your patient outcomes, your patient experience, you're reducing costs, and then your staff engagement. So I'll kind of touch on each of the 4 areas, but starting out with patient outcomes. So with a spirometer, it's designed to make the detection and management of asthma, COPD, and other respiratory illnesses at the primary care simple and effective. So again, we spoke to how, unfortunately, these disease states, they don't have a cure. So if we can go ahead and, test them sooner, we have the likelihood of improving their overall quality of life and hopefully eliminating some of those preventable exacerbations. From a patient experience, some of the embedded patient, videos that are there as a reference for them, talking about how to properly hold the device, how to use the nose clip, what that test effort is really supposed to look like, can help set expectations for that patient up front, giving them a more positive experience. Because if we can get, 3 test results that are quality test results up front, right at the very beginning, we're preventing them from having to do unnecessary additional tests. So not only are we setting those expectations up front, but we're just really improving that overall testing process for them. You know, spirometry is a tough test, and so I think if we can help them up front, it'll make the overall experience better for them. And then to cover the cost aspect of it, I think we touched on this just a little bit earlier, but both COPD and asthma have no cure, and the damage to the lungs cannot be reversed. But with early detection and treatment, we can again slow the progression of the disease and implement better management treatment. So by better disease management can then help overall lower those direct and indirect costs that the healthcare system may be experiencing. And then kind of for the fourth area here, you know, it's staff engagement. So just like we have, you know, training videos focused to help set expectations for the patient, they're there for the staff too. You know, some staff, they may not be doing this test very frequently, or they may be new to the clinic and new to that specific spirometer. So by providing these embedded coaching videos, it's giving that staff that guideline as well. So it'll help coach them through. So it's not just the patient that can, you know, draw the benefit from it, but that staff has that guideline and support system right there as well, to ensure they are conducting that test properly. So again, it's giving them the support and the confidence to do a test that they may not have a lot of experience with.
Great. Thank you, Kylie. So that takes us to the end of our webinar. Thank you again, Kylie and Dustin, for your time today. Really enjoyed your presentation.
Thank you. Appreciate you, everyone joining in.
And to our audience, we value your time and feedback. Please take a moment to fill out our brief post-webinar survey so that we can provide the best content and resources for you. And we'd like to once again thank the sponsor of today's webinar, Midmark. For more information, please visit midmark.com/medical. This webinar will be available on demand, and a link to a recording and a copy of the slides will be sent to webinar attendees within the next 48 hours. This concludes today's presentation. Everyone have a great day. Thank you.